Again, my name is Michelle Comer. I'm the Commerce Commissioner, and I am thrilled to be introducing North Dakota's State Health Officer, Mylynn Tufte. She brings 25 years of experience in healthcare. Her first-hand knowledge of caregiving as an ICU nurse has helped shape her passion for healthcare information systems and technology. Mylynn was appointed in 2017 by Governor Doug Burgum. I am proud to call her a colleague and a friend, so please help me welcome Mylynn Tufte to the stage. I'm going to give you a hug.
Thank you so much. Thanks for
Good
bringing
luck.
them out to the front.
Yeah, absolutely. Have fun. You're getting a hug too every
Good morning. Wow, it's hard to follow the Surgeon General, the First Lady, and the Governor. Aren't they great? Yes. We had such an informative discussion, and we really are grateful for them being here and sharing their time, but also for you being here and sharing your time with us, because what we're going to talk about kind of builds on that discussion and is such an important topic. Just some housekeeping items that I think Michelle mentioned. We wanted to make sure that you complete the pretest. If you leave them on the table, we'll pick them up right away. The disclosures are on the evaluation. It looks like this. Please complete the evaluation even if you don't need CMEs. This is for the complete program. And if you're going to more than one health track session today, you can hang on to it because this is an evaluation for all of those sessions. So that's the housekeeping, and now we can get on to some more fun discussion. I want to introduce our panel. We have Kurt Snyder, who's been the executive director at Heartview since January of 2005. He's also a licensed addiction counselor, licensed social worker, and has a master's in management. Next to him, we have Kathleen Wrigley. Kathleen's a licensed independent clinical social worker, and she currently serves as Shiloh's elementary school counselor. Kathleen received a master's degree in social work and a master's degree in science and school counseling, double mastered too. Her work has focused on youth, counseling, adjudicated delinquents, directing child advocacy center, and serving as a child forensic investigator. Chris Dumerici is an entrepreneur, and I heard Chris speak at the Governor's Education Innovation Conference, and we're in for a treat. Chris currently is a student at North Dakota State University, majoring in management and focusing on entrepreneurship studies. He's also the founder and CEO of Enlight LLC. So with that, I'm going to turn it over and ask Kurt to give us a first start, and then I have a set of prepared questions for them, and then if there's time, we're going to take some questions from the crowd. So thank you so much. Kurt.
Good morning. Thank you everyone for being here and for me being here. It's nice to be here. My introduction I wanted to share with you as well includes that I am a person in long-term recovery, and for me, for drugs and alcohol, and for me that means I haven't used drugs or alcohol since June of 1993. Thank you. I happen to be married to a pediatrician in town here, and so by virtue of being a physician's husband, I go in circles sometimes with a lot of people in healthcare, and when they hear what I do as director of a drug and alcohol treatment program, they always, well, not always, but most often the comment I hear is, that must be hard. And I've always struggled with why do they say that? Because my job is incredibly rewarding. But I recognize that the people that struggle with the disease of addiction cycle in and out of emergency rooms, walk-in clinics, jails, and many other things in the course of their illness. And those people who deal with those individuals see them at their worst point and in the ugliest spot of their addiction. What I get to do is I get to see them come through the door broken. There's no spark in their eye and no hope in their heart. But we recognize that that is somebody's person, someone's loved one, and we get to see them recapture their life, and it's an amazing thing to be a part of. In North Dakota, well, nationally, 1 in 10 people are estimated to struggle with a drug or alcohol abuse issue, but only 1 out of 10 of those, so 10% of the 1 out of 10 ever make it to treatment services. And they attribute that a lot to shame and stigma that surrounds it, that it's too shameful to seek help. Most of those people that struggle with abuse of their substances are employed and in the workforce. So if you think of 1 in 10, it's easy to do the math, and I do it a lot of times. My child goes to a school where there's 20 kids in his class, and I always think that there must be 2 or 3 children in there where their parents are struggling with drugs and alcohol. So it's something that none of us are immune from. We all know somebody. We all have loved ones that struggle with this. Another thing that I want to point out for North Dakota is that we lead the nation, or always in the top 5 for binge drinking. And binge drinking is not a category we want to lead the nation in, but we lead it in binge drinking and rates of abuse and addiction. And then we look at our communities and we see rural North Dakota, and there's a lack of services that is throughout the state of North Dakota. And these people that come for services have to go back and try to regain and recapture their lives in communities where there's no or very little services. If you look at small town North Dakota, many of them can't support a grocery store, their schools, co-op, but yet they still have two bars, kitty corner from each, in every community. So it's a little bit about our culture, but it's incredibly important to understand that these people live in and amongst us. Everybody has a loved one that is one of those individuals that are coming forward that are struggling with this illness. I got to tell you that the Surgeon General and the Governor and First Lady, this is really intimidating. Very nervous. I talk about this every day in the work that I do, but it is incredibly scary up here with these lights. So,
You're doing great. And you have such an important message for everyone to hear. So thank you so much.
One of the important messages that I want to point out, especially for the young people, is there's an American Academy of Pediatrics study that came out that says that if you start using drugs and alcohol at the age of 14, 40% of those individuals will go on to have lifelong issues with substance abuse. There's another study with the National Institute of Health that says that if you start using alcohol at 15, your rates of lifelong substance abuse, 16, 17, and 18, and the rates go down every year from there. So there's a real message that I think we all need to hear, and that is that addiction is an illness of early age onset. And the longer we can keep our loved ones or our children from using substances, the better chance that they don't have that journey that they have to live in their life. And we need their time for their brains to develop. So thank you. I'll stop right there and let others.
Well, you gave us a great lead-in and some very powerful words, because I think that the studies also show that when people get exposed, young people that get exposed, they got an opioid prescription out of their family's cabinet, or a doctor gave them to them at a very young age, or someone that's very close to them, they knew that they might get that exposure. So I think those are things that we're trying to address and have discussions around. What's the role of parents or that older adult figure? And so having someone like Kathleen available, it was great to hear your point of view from a school counselor.
Thank you. Is this on? Can you guys hear me?
Maybe.
Yes, okay. So my name is Kathleen Wrigley. I'm very, very touched and honored to be on this panel today. I am a school counselor at Shiloh Christian. I have 3 children, so I think that gives all of us parents really a unique perspective. on mental health of children and exposure to some of the terrifying things that kids are exposed to today, starting with the internet. And then, you know, there's just a lot. You guys have a lot on your plate. You are exposed to a lot, and we want to do everything. It is our mission in life to do everything that we can, not just as professionals, but as parents, you know, to help give you the tools that you need to navigate life and to make good choices. So I am a native of Philadelphia. I, too, am nervous, as Kurt said he is, and a little intimidated, having such prestigious and friends too in the office, but in the audience here, but such prestigious people in the audience. Thank you, Surgeon General, for coming to North Dakota and spreading your message. Thank you, Catherine, First Lady Catherine, for having these kind of summits and bringing panels like us together who are out in the trenches with kids and it's spreading these important messages. Kids, thank you for coming. I should have brought some of my students. I think that they would have really benefited, and I will next year. So, I am a native of Philadelphia. I was born and raised there until I married a North Dakotan, and I have been here for 23 years. So I think that kind of makes me part North Dakotan, don't you? I have been a licensed independent. I'm also nervous. I mentioned that. So I'm used to talking to kids. So I'm going to pretend you're all kindergartners. Is that okay? All right. Then I'll feel a lot better. So I wrote some things down here so I don't forget any of my points. I'm a licensed independent clinical social worker, my first master's degree, and I have been licensed in the state of North Dakota since 1998. So don't bother doing the math. It's just fine. I went back to school a couple years ago to University of Mary to get another master's to be a school counselor when a position opened up at Shiloh. I have a column for Moms Magazine that I write, Just a Thought, for On the Minds of Moms Magazine. It's a side gig that doesn't pay the bills, but it's really fun, and it's nice connecting with other moms. One kindergarten little girl this year referred to me as the tall, huggy lady, and I love that. I may put that on my resume. I may put that. I actually really do want to get a little sign for my door at Shiloh. It is a great responsibility, very challenging, and very, very rewarding to be a school counselor and to be helping kids. Obviously, one of the best ways to build a connection with kids is to build a rapport and just be there, right? And be in the trenches with them, just to build a connection and relationships. That's the key. I was raised, my parents divorced when I was just a baby, and I was raised by a single mom who probably wasn't equipped to be a mom. She turned to drugs herself, starting some mental health issues. She turned to drugs as a way to help her heal and self-medicate. And it was a very troubling, I saw and was exposed to a lot in my younger years, and I think that really I have turned that experience into being able to connect with students and just being able to say, like, you know, here I am now, but this isn't where I have always been. Like, I get it. You know, I see you, I hear you, I feel you. And so I think that the culmination of my childhood and my professional training, but also being a mom, really has helped me be the best school counselor that I can be for these kids. Thank you so much for being here, and here's Chris.
Thank you. So I really like standing up when I speak.
Yep.
So my name is Diamersi Christel. I was born and raised in a refugee camp in Tanzania, and I moved here in 2010. And one of the biggest things that kind of happened when I moved here was, you know, I was going to school, and well, first thing, my teachers didn't know how to say my name, and I couldn't really connect with them. And as school progressed, I was super bored in class. And so, you know, and I'm one of those people that if there's a problem, I will try and figure out how to solve it. And when I basically graduated from high school, I went on this mission. I was like, well, I'm gonna go solve boredom in class. And that was not fun because it's a very hard problem to solve. But the more that I started talking to teachers, the more that I started finding out that they have a very, very, very hard job. And like they were just basically telling me, they're like, hey, Chris, we're like public speakers who don't really know who their audience are until the middle or the end of the semester. And when like I started learning all these things about, teacher to student relationships and how knowing your students is very important, I started, I felt like I was called or challenged to help teachers become experts on their students. And so I started an app called Enlight. So I'm a student at North Dakota State University, and my app basically understands who the student is in about 30 minutes. And the way we do this is we build a profile for students, and this profile gets to know who each student is in your classroom as a teacher. And we ask the students, like, hey, what are your interests? What are your passions? And we even ask students, if you could solve any problem in your community or the world, what would it be? So we ask these questions to try and really get to understand the students, like what motivates you. And what I've been finding out is that some students don't even have a passion or motivation, even interest. And like for a teacher, like basically I feel like most teachers go into teaching so they can empower students. And I always ask everyone like, hey, tell me one or two, like how many teachers when you went to school that made an impact in your life? And usually these teachers is like one or two is like a middle school teacher or a high school teacher. But my goal is to literally help each teacher know who each student is in the classroom. So we even ask them to help them a little bit by asking the teacher, the student, do they like a visually immersed classroom? Do you guys like projects, or do you like, boring lectures? Well, I think lectures are boring. But like everyone has a preference, and kind of what the Surgeon General said earlier, like each city is different, so is each student. But it's very hard because teachers have too many students and not enough time to like get to know who each student is. And so it's the end of the semester when they get to know who each student, and then like it's usually too late because the students have to move on to the next class. And so from that, we basically build like this class profile. So this class profile basically tells the teacher like, hey, here's a breakdown of your classroom. Here's the top interest in your classroom. So if you're gonna make jokes, don't make jokes about like some things that won't even connect to your students. Make jokes about technology, math, so we can even tell you like, here's a top interest, how your class breakdown. So for this class, like 75% of those students say they really like projects, and like the top interest in that class is technology. So how can a teacher take that information on this dashboard and basically use it to not only engage students, but to build relationships with them through like knowing what their passions and what their interests are. And then on top of that, so as students, I know you guys know this, but at the end of the semester, we get these like surveys from teachers. They're like, hey, how did I do? It's either I don't really like you because I had a bad grade, or I really love you because I have a good grade. And so what we do is like we help teachers survey their students so they can get feedback from the students during school, because the more feedback that you get from your students, and now like as a teacher, you're not only learning from your students, but the students are learning from you, which kind of betters a classroom to build more relationships. And that is very, very important to us, especially for me, because when I was in high school, like one thing that was happening was like some of my teachers just thought that I was I was a C student. They didn't think I was very smart, but they didn't know that like at home I had these passions. I was like a beast of photography. I was like crazy with like Photoshop. I was really good graphic designer, but none of my teachers knew that. But none of my teachers even asked me like, hey Chris, what do you do at home besides having bad grades in school? And so, but like, as I was building this, one thing that kind of happened was I got challenged. So, it's not just about that. It's not about just knowing the students. But so I basically built this on how we can help students report tools. So we're basically building on our app a better way to report behavior from students. And so like we have 3 buttons. And so, because like some students, like when we're going through school, you just have a bad day and you just want to talk to someone, but you don't want to say anything. You feel kind of like nervous, and so we built like a green button for that. So you basically click it, you choose the teachers that, hey, like these teachers I really connect with, and you can basically choose those teachers, and you send them just a notification saying, hey, like Chris needs someone to talk to today, like they're feeling a little lonely, and so you don't actually have to go say it. And if it's like a little bit more serious, you press, the yellow button, and the yellow button kind of goes to the counselor or like someone who's like, at least a little bit more serious. That you say, hey, like maybe I'm a little depressed today. And the red button, if it's something that's like super serious that might need to go to the counselor or the police, that maybe you don't really want to talk about, but you just want someone to know that something just kind of happened and maybe they can approach you first. Because some of us don't really want to be the first ones to make the first step, to take the first step. And this would allow the student to just say, hey, something is going on without them like being kind of scared. But yeah, so my challenge to you as teachers, as everyone in the crowd, is to be more empathetic. I think the more that we understand about each other, the more that we understand that some of these problems can be fixed by just like saying, hey, I see you, I hear you, and yes, there's help, and that will help you. It's more important than just like having stigma and judging people. Thank you.
Wow. So in preparation for this, we talked that each one of these speakers we could listen to and have an hour discussion about the work that Chris is doing, the work that Kathleen's doing, and Kurt. So I'm just going to focus in on a little bit of things here. There's a lot to unpack. Kathleen shared a great story, and I know that. But maybe, Kathleen, if I could go back to you and just say around shame and stigma and eliminating that, how we've heard that 1 in 10 people don't seek treatment for their addiction because of that shame and stigma. So maybe talk a little bit about how you personally overcame that, and then what you might recommend as lessons learned to improve access.
Oh boy, that is a really loaded question with so many different answers and so many different avenues. I'll start with, as Chris was talking, I was thinking about this. When I was a kid, I was not noticed. I was going to school dirty. I was going to school with bruises. I cannot believe when I look back, and I went to, for 12 years, I went to a Catholic school in Philadelphia. My mother worked at the school so we could go for free because we were indigent. But no one did see me. The nuns that taught us, the teachers, the laypersons, they did not see or notice. And I remember my brother and I watching on TV. I think that my second point is outreach. This is an excellent way to reach the community, to reach the students, to reach the professionals, to have people up here to tell their stories, not just professionally, but to tell you where to go for help, but to share, that I was embarrassed to talk about my childhood for a very long time. And then I thought, you know what? What good is it doing that I'm not talking about it? There are lots and lots and lots of kids who come to school that are having some serious issues at home, okay? Talking about addiction, and the stigma of addiction. And the breakdown, I'm going to piggyback on what the Surgeon General talked about, the breakdown in the communities. There's a breakdown in families, too. There is. There's a breakdown in families. And kids are kind of left shuffled around. Parents are divorcing. Now, I'm from a divorced family, so I work with kids every day that are, going through their parents' divorces. I'm not saying that it can't be healthy. It's not going to kill a child, but it will affect them if you're not co-parenting and doing it in a healthy way. It will affect your child or the children. And then they will go off and they will get into all sorts of trouble making, bad choices. Their kids these days are exposed to so much. There is a very disturbing fact that through technology, there's pornography. The average age of a child who is first exposed to pornography is 11. Let that sink in, you guys. 11. And it's addictive. We talk about drugs and alcohol being addictive, technology, your phones, pornography. There are lots of addictions out there. Pornography is very addicting, and it is a very, very big issue. And the stigma, you know, that's tough to talk about. But we do need to talk about all these issues. We need, the kids are coming to school, we need trained professionals. Chris also mentioned the ratio between professionals and students. We need more school counselors, you guys. I have 253 students and I'm part-time. There's not enough time in my day to see the kids that need help. And so we need more trained professionals. We need trained professionals who are trauma trained, because there are so many kids coming to school, even at Shiloh Christian. We're not immune to anything. There's so many kids coming to school who have social, emotional, environmental, behavioral problems, and we need professionals who are trauma trained.
So with that, I'll turn it to Kurt for the same question. What are you doing in response? You're the executive director of Heartview. You provide services. You're probably seeing the same workforce shortage. So what are your thoughts related to improving access to care and those health outcomes?
You bet. Access to care, some of maybe the lessons we've learned around this is that we have so isolated silos of care, and the collaborations really make a difference. And so, collaborations that have made a difference for that would be with law enforcement and the hospitals and public health. And, the more collaboration and the more people you can bring to the table, because, we're all dealing with the same people. And, I just wanted to say something about the shame and stigma. The disease of addiction is a brain disease, and when you understand kind of the hijacked brain, that people actually, it's the brain, I'll make a profound statement. I think it's profound, maybe you won't, but drugs and alcohol don't get you high. They don't. What they do is they release the high, and the Surgeon General talked about that, the high that's already within you. It releases the endorphins. They've actually come up with medications that block that, to where, Vivitrol is a shot in your rear end that you get, and for 28 days, if you were to use an opiate, you would feel nothing. You don't get high. It blocks that. So the science behind it is incredible. And so when you understand that the crazy thing that you're watching people do when they do have a substance use disorder is, the hijacked brain, the message they get is, I need to use, almost like I need to breathe. And so because of that, they make choices that you can't understand, like how could that lady use when they're pregnant? How could that person use when they're on probation, they go to jail and they lose the ability to care for their kids? Why would they do that? Do they love the drug more than they love the individual? And the answer is no. One of the best ways to kind of understand substance abuse is to be able to ask the question, what's the five most important things in your life? And if you were to list those things and see that people are using drugs and alcohol in spite of those important things, that's the hijacked brain. That's that people are using, and it's not a choice. It's that message that's so powerful. So I know that wasn't quite your question, but I bounced a little bit. I wanted to talk a little bit about that shame and stigma.
No, that's great. That was a great discussion and so important and powerful. I want to go back to Chris in the work that you're doing, because the Surgeon General's motto is better health through better partnerships. And you have taken that to action. You've engaged. How do we give tools to our teachers that help communicate who we are, so you can say, I see you, I know what you like. So maybe, Chris, what other calls to action have you seen? Because you've had an opportunity to talk to lots of people about the work that you're doing.
So I'm gonna kind of give a little background story. So I had a buddy of mine in high school who kind of had fentanyl addiction, and he passed away in 2016 right after from an overdose. And I was very close to him, but the problem was he kind of just didn't connect. So he came to class very high. And like for us students, I think we kind of have that non-snitch culture of like, I'm not gonna snitch on my friend because he came, you know, like high. And I always feel kind of like guilty sometimes because I saw it, I knew it was happening, but like I felt like I didn't have, not really an obligation, but I didn't want to tell because I didn't want to tell my friend. So like one thing I'm gonna say first as a call to action, if you're a student and you see it happening, like it's not really snitching because it might be saving a life. But like as I saw, like he got caught in school. Like the administrators caught him and they just put him in juvie. And he literally was going back and forth. And it's like, oh, you're back again. It's like, oh, I'm in school again. So, and that was kind of like a little problem. But so my call to action would be for students. Like if you see anything, it's not really snitching because you never know when you're actually going to save a life of a fellow student or a friend.
Wow, that's a powerful story. Thank you for sharing that. I'm sorry about the loss of your friend. Because I think that that's the discussion that we're having. If your friend had diabetes and was having an attack of their blood sugar, would you feel like you were snitching on your friend to try to save their life? That's the shame and stigma that we're trying to address here. And I know we're running short on time, and I was gonna see if there was a question from the crowd. If not, I can move on to Kathleen's call to action. But if you want to tee up a question, we have a microphone that might be circulating for you, or you could come forth. Kathleen.
Thank you. I just wanted to say that as a school counselor, there's so many things that we're on the front lines with these kids every day, and we get to see them and know them. And one of the, thank you, Chris, for sharing your story. One of the things that we get to do, and I think that is really, really important for us to do, is to get into the classrooms. You know, there's so many students and so few of us, but to get into the classrooms, do classroom lessons so that we can build that rapport, because we all know, and I think we have reiterated the same statement, and the Surgeon General did too in his comments, connection is the key.
It is.
Connection is the key. And so building, as a school counselor with the kids, helping to get to know them at their level, go to their level, and get to know their not just who they are, but where they come from, their families, and how you can help. I also run 2 mentoring programs at Shiloh. It is a fantastic opportunity for these kids, not just the big kids. We are blessed because we have a K through 12 school, and so we use the high school students to mentor some of the elementary students. It's a confidential program, but the elementary students are referred to the program. It's called Trust in Teens, the TNT program, the one program, and then we have a Prayer Buddy program as well. So these mentoring programs really, they touch the lives. You should hear the testimonies of the high school students who are going out and reaching out to these little elementary students who, for whatever reason, they're having social, emotional, environmental, family situations at home. They just need extra love and support while they're at school. I think those connections, and it doesn't just have to be through us, trained professionals. It's just getting kids to reach out. And these kids, some of the mentors, they themselves are having social, emotional, behavioral problems, but reaching down and lifting someone else up, it is phenomenal. It just brings tears to my eyes just watching some of these students connect. And I think connection is key. Connection, building relationships so that you have students who feel safe coming to you, they know that they can come to you for help and guidance, and just keeping more counselors within the schools too that are trained, professionals that are trained to help students, and building up not just families and schools and communities as well.
Great. And Kurt, what would be your call to action for the community, for providers?
Well, I guess I'm a fan of science, and the Heartview Foundation really pursued medication-assisted treatment, and that's the use of medications to treat opiate use disorder. And we've been working with medications for 15 years. We've been actively doing it as an organization for 12. And there was always in my profession that you can't use a drug to treat a drug addiction. However, the science said opposite. The science said that 10% of the people without medication-assisted treatment would stay in treatment, or 65% would stay in treatment with the use of medication. And so sometimes the call to action is to follow the science, even though the stigma or the norm is different. For example, syringe services, needle exchange programs, very controversial. But you know, the science is really clear. The science shows that it decreases communicable diseases like HIV and hepatitis. It saves money for the community in incredible ways. And a lot of times the communities think that by choosing to embrace these types of programs means that we're condoning it. And it's not. It means that we're being actively smart about how we deal with the issue that is in our communities no matter what. So my call to action really is for communities to collaborate with partners maybe you haven't before, to embrace programs that maybe you aren't comfortable with, but the science is clear. And so the science is always pushing back on addiction. And I think one comment I'd make about addiction is addiction lives in the shadows. And part of that is because of the shame and stigma that goes with it. But because it's in the shadows, we don't talk about it. It's like sexual abuse or physical abuse. People who are in the middle of that, they don't talk about it. They're afraid and scared of talking about it. And we need to bring behavioral health issues out of the shadows and understand that it's a condition just like any other, like diabetes or something else that is very treatable. And these are not throwaway people. These people are family. It's somebody's son, daughter, cousin, mom, or dad. So,
Right.
Thank you.
Thank you, Kurt.
One more thing, if I may. Okay, I have 30 seconds. I will be so mad at myself if I got off the stage and I didn't talk about a call to action and how I personally got through some of the things and how I help students get through some of the things that they're facing and the challenges is through faith. Faith. My faith is my most reliable gift, and it is a source of strength and power, and just having being called to higher being, a higher spiritual force brings accountability, it brings strength, and it brings just fortitude. So I really do think that faith for me personally and prayer has been just a great gift in my life, and I know that I see that in students as well, and I think that that's an important piece to a call to action as well. Thank you.
Wow, there was so much there, and I want to end with some of our shared values at Team North Dakota. Gratitude for you coming up and sharing your stories, sharing your work, your expertise, and your experience. It was amazing, so I appreciate that. We dug in on courage and having the courage to end the shame and stigma related to behavioral health and substance abuse and misuse. We talked about humility and knowing that the science is showing us different things about brain development, about the chronic disease of addiction. So thank you for having humility in that area. And lastly, the curiosity to keep learning, to keep growing, and to spread that to so many people here as well as in the work that you do. So thank you so much.